And you guys, you don't have any experience? Maybe Salome?
Like a nurse, I don't did it. I don't do that. I don't give diagnostic of something like that because I'm not a doctor.
But you weren't with the doctor while he was giving the notice?
Can you repeat it?
You weren't with the doctor while he was giving the notice?
No, I don't have that experience because I think like as Lee said, is a specialty doctor who must do that.
Okay. Okay. So no one of you is interested in specialize as a oncologist, right?
No.
No. Okay. I think it's the worst specialization, right? Because it takes a lot of, I don't know, tough words, tough heart to give this kind of information to your patient.
Yeah, I think it really hard, really, really hard, especially when the patient are kids or child.
Yeah. Is there something like volunteers, oncologist volunteers in your country?
Hmm, I don't know, teacher. I think no, because I never ever listened about that.
Okay. We have something like that here in La Paz, and it's it's so hard to see, as you were telling, that children has these problems, even more when they are, I don't know, 8 months, just 8 months, and they have these cancer problems. It's so hard. So would you help me? I don't know if you need me to explain some words here.
Nagging cough, it means like persistent cough, right?
Right. Is that
Okay. And a sore is it's like pain that doesn't heal, right?
okay? It would be a synonym then.
Yeah, I think
We
it is.
no continue.
I think it is a synonym of pain.
Yeah,
Yes.
it will
Okay.
work. It will work like that. But I don't know if you have any other information there, or we are agree.
Information about what,
Yeah,
teacher?
about the meaning of a store.
Sore. Um, Let me look it.
Okay, we already know the word small or word. We used it just a few classes before, so I think we don't have so much trouble with this. Okay, we will going ahead. Okay, Salome, can you read the this box, please?
Sure, teacher. Um, a 33 years old man presented to his GP complaining of a painless lump on the right side of his neck. which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kilos in weight. He has also complaining of night sweats. He had no significant past medical history.
Okay, thank you.
Welcome, teacher.
Then Liz, can you read the treatment of tumors, please?
Sure, teacher. Treat of tumors. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms.
Okay, so we have the symptoms on the right. Carla, can you read those symptoms, please? Or types of cancer, I'm sorry.
Yes. Types of cancer treatment: surgery, radiation therapy, chemotherapy, immunotherapy, hormone therapy, targeted therapy, stem cell therapy.
Okay, thank you. So if you can name from 1, 2, 3, 4, 5, 6, 7 to 7, what would be the most invasive ones? Or 1 to 3, okay? In your knowledge. I know you don't have any experience in this area, but I think you are most you read about it.
I think surgery, radiation, and chemo, because, well, the surgery is totally invasive, and radiation and chemo change your body extremely.
Okay, thank you. What do you think, Carla?
Well, I worked 2 months on an oncology institute.
Mhm.
So the things that I saw the most was the chemotherapy, then was followed by radiation therapy, and the least common is the surgery because on the oncologist institute they manage the most advanced cases. So surgery wasn't an election. The other ones, I think we don't use it in Bolivia commonly, but I think in some places they do it.
Okay, thank you very much. And you, Salome?
Um, I agree with Liz um, because that is the types of treatment that we have. But I think the more toxic could be the radiation or chemotherapy. But for other way, in our country exists the mm, biomolecular medicine,
Okay,
and that is a kind of treatment for cancer too.
that's interesting. So we can add to this list, right?
Yes, teacher.
And I think it's the less invasive.
Uh,
Me-
no, also is more invasive than this one because you need to eat or no eat drunk a radioactive component.
Oh, wow. So it is a liquid,
Uh, what is the meaning of liquid?
líquido.
Yes, it's a kind of liquid that you need to drink, and uh, and that is more specific is for the thyroid for thyroid cancer, the cancer of the
Thyroidism cancer.
that.
Okay, I didn't know about that. Okay, thank you very much.
Welcome.
Well, I don't know if you want to add something else that we didn't know about this topic. For example, I know barely something about the differences between radiation and chemotherapy, but I don't know if you can explain to me a little bit.
Well, radiation, you use a machine to give like a shot, a laser shot specific. And the
Mhm.
chemotherapy is like Salome said, a liquid. It's like intravenous. Um, that's the main difference.
Okay. And what about the mechanism of action? I know that both interfere with our cells, but not only the bad ones, right? But with the good ones too. Or am I wrong?
Yes, but radiation is, like I said, more localized. And I think the doctor tried to attack only the bad cells, but chemo kills good cells too.
Okay, now I understand. Anything else you can add, guys?
I don't know. I don't have too much knowledge about this topic. Sorry, teacher.
Okay, it's okay. We are here to learn. They are doctors and they are explaining to us
Yeah.
very good, I have to say, so we can have the more a good panoramic vision of what does these things do. Okay, so it's very good. Thank you, guys. Okay, so we're going to talk about something better. I think you have a lot of experience here. I want you to tell me about pregnancy and childbirth. Carla, can you read it, please?
Sure. Pregnancy and childbirth. Childbirth. The expected date of delivery, ADD, is the date on which a woman is expected to give birth to the child she is carrying, pregnant with. It is calculated by adding 280 days or 40 weeks to the first date of the last menstrual period, LMP. Childbirth is also referred to by doctors as parturition. Delivery is the process of helping the child to be born. A spontaneous vaginal delivery, SVD, is a normal delivery. If there are complications, the baby might be delivered by cesarean section, surgical removed.
Okay, so I think it's pretty common for you to read this. You are more like you had experience in this area, right? I want you to know that parturition is also a synonym of uh, deliver. Okay, it can be used like parto. It means parto. Okay,
Okay.
thank you. Well, Salome, can you read it, please?
Sure. A full-term pregnancy is 40 weeks, divided into three trimesters. A baby who is born before this is premature, and one born after 40 weeks is post-mature. A baby dead, for example, because the umbilical cord is around its neck, is stillborn. A pregnancy may end before term spontaneously, with a miscarriage, spontaneous abortion. Or B, that voluntarily terminated with an induced abortion. Is correct. Abortion.
Abortion is correct.
Sorry. Termination of pregnancy. Not. The verb induce means to cause something to happen.
Okay, thank you very much. So I want to know if you have experience with a post-mature baby. I don't know if you have to wait more than 40 weeks in your experience. I don't know.
Yeah, I have babies like that. Usually be too large or maybe too big or maybe too big. And usually the babies are, I don't know how to say in English, arrugado.
Arrugado. Can you look for in a dictionary, please, someone,
Sure,
while she can help us?
wrinkled.
Wrinkle. Yes.
So the
How
baby
to
is very,
forget our
very,
wrinkle?
very wrinkled.
Okay. Of course, maybe they don't even have a tisular liquid.
Um, I think because they are in tissue liquid a lot of time. That's the way they are wrinkled.
Wow. Okay, I don't know if it is connected by the umbilical cord. They can breathe normally, or
Yes,
not.
yes, sure.
Okay, which will be the the problem then?
Mm, the main problem is that if the baby is too much time inside, it defecate inside. It
Oh,
causes meconium,
yeah, right.
and the baby almost drink and breathe it. This is the problem. After that, the baby maybe can have pneumonia because of that.
Yeah, I heard something about that. Okay, so I don't know, Salome, if if there is something you can do to induce to the to make them burn quickly.
Yes. Exists a medicament called oxytocin. Oxytocin, I think.
Okay, oxytocin.
Yes, that is like we use this for make a little induction of the part.
Mhm.
Um, that is we start with low doses, and with the time we is increasing the doses for to induce the part, but we use this only in necessary case because the childbirth has to be natural, really natural.
Yeah.
So that is when sometimes is the time is prolonged when to the el tiempo de parto es prolongado
Mhm.
as
A long time of deliver.
deliver. Something for that case we use oxytocin.
Okay. And Carla, what about the I don't know if these child will have some trouble with their mental illness. I don't know if they will have or not necessarily.
When they have more than 40 weeks.
Yeah.
Um, well, what I know about the babies can stay there until 42 weeks, what I read about. and after that they grow too much, and they trap the umbilical cord, so they don't have the same irrigation, arterial irrigation, so maybe they can have a retarded illness, maybe mental retarded, what we learned before.
Yeah.
And they don't have to be there, so we induce the liver. That's
Yeah.
why they do it. So yes, it's a probability that they can have that, so we do that.
Okay, thank you very much. So it's better if a baby stays just 40 weeks, right? And then just born. Okay, I want to know something else. If someone is working in the liver, but the mother wants to have by natural part, and she waits a long term, does it bring some problem to the baby?
I think when the position of the baby won't vary a lot. So if they are transversal, and if they want to wait 20 weeks, it won't change. So they must go to cesarean. There is not option. It depends. If she has the probability to have a partition, what do we call it, to be deliberate, to
Mm-hmm.
have a delivery, so she can. But there are some circumstances that wouldn't vary because the time. So it depends the case.
Okay. I ask you this because I had a friend that was pregnant, and she wanted to wait in labor, like, I don't know. Doctors said that you only can wait 3 more hours. Otherwise, your baby is gonna die or have some problem. But she wanted to have a natural delivery. I don't know if you can tell me something about
Oh,
this on your experience.
the partition was initiated, like she had contractions and everything.
Yeah, but she wanted to wait for a natural one. And maybe because of the age, I don't know. She she couldn't, right?
What age was she?
34?
Sorry, for first child.
Yeah,
Oh, and everything was going good, or she got a problem? She couldn't. Her cervix wasn't opened as she wanted.
I really don't know, but I think she wait like maybe 7 hours, and
Wh-
she just couldn't. The doctor told her that she had to have baby in 3 hours, more or less.
Ye- Yes, we have in the first child till 12 hours to have it. Like you can't wait more because maybe she romper fuente. I don't know how to translate it. She So the baby wasn't with the umbilical cord. Like it hasn't the oxygenation, so it could lead to uh, retarded mind later. So we
It's
have 12 hours. If she doesn't
okay.
answer with medication, with stimulation, with anything, so she has to go to cesarean.
Okay, could be. fetal suffering?
Yes, yes.
Okay, I understand now. Thank you.
No,
So we have labor is the process by which the fetus and placenta are pushed out of the uterus. It is divided into four stages. Some words which are combined with labor are premature, prolonged, spontaneous, induced, and false labor. Okay, so I don't know if you can maybe give me an example of one of these. When can we call maybe a premature one, a prolonged one?
Sure. Premature labor is when the childbirth start before the 37, not 36 weeks of pregnancy.
Okay.
So that is a premature labor. Sometimes this could be natural, but sometimes it's necessary to be a chirurgic process for delivery the baby.
Okay, thank you very much. Someone else wanted to give me an example?
Sure, for example, prolonged, it will be like Carlos says, if the delivered or maybe well, while the mother is expecting the baby, the work um, is still more than 20 hours. If the kid is the first, in maybe 14 hours, if this is the second one. Spontaneous is when start the labor. It's normally induced when you use a drug to help to the deliver, and false, maybe false contractions. But it's not time yet.
Okay, thank you very much. I have another panorama now. Well, then we have the presentation and lie. Okay, which is a fetal lie is the position of the fetus in the uterus. The normal lie is longitudinal, and the abnormal lie is transverse. Fetal presentation refers to the part of the pelvic canal to the part of the canal on which the examining finger feels on vaginal examination. That is called Butterworth. Okay, so I have a question here. How many fingers, maybe, I don't know if it's called like that, finger feels have to have a woman to know that it's just time for have a baby?
Well, it's not how many fingers. You use only 2 fingers to medir. How is?
To have I will look for.
Well,
Sure.
to get an idea that we know when while we are open our fingers, we count 10 centimeters, and if it's in 10, is ready.
Okay, to do the medition.
Okay, to do the medition.
Okay. The normal presentation is with the head vertex presentation. That is another way to call. Okay. Bridge presentation means the buttocks are presenting. Bridge is an old word for buttocks. Okay. And abnormal presentations may require delivery with forceps. Okay, so do you understand all of the words and meanings in context?
the meaning of bridge?
Bridge is an old word for buttocks, says here. Okay, we will tell, uh, oh, the meaning in the dictionary is like a recámara, but in this context, it's like when the baby comes the buttocks side, okay?
Ah, okay.
Yeah, normal presentation is with the head, is the vertex presentation, right? And the bridge presentation means the buttocks are presenting. Bridge is an old word for buttocks,
Okay, thank you.
okay? So, do you have any experience, I don't know, watching maybe someone, some doctors working with this forceps?
No, I haven't seen that. Actually, in our law, uh, it's don't allow use the forceps. We can't use that.
Yeah, I think it's pretty, I don't know, dangerous for the baby or no.
Yes, exactly. You can cause some damage in his or her brain, cranium.
Yeah, I think the same. I don't know in which cases maybe can be used this. Do you know?
I think when the baby can go out more or less, and the forceps used to help to get out the baby. But I think that, but like I said, I didn't see that. We don't use here.
Yeah.
Once time I saw, but knowing um, for a childbirth, I saw an interrupt of the pregnancy with
Oh,
therapeutic treatment.
to interrupt, like in an abortion.
Yes, but is what that was therapy because the baby was really illness. So the doctor decided that be better to interrupt the pregnancy.
Oh, sad that.
That's very sad.
Okay, so better we don't use this in our clinics. Okay. So we have another topic here, the respiratory system. Can you read it, please, Carla?
Sure. The respiratory system, cough, is a common symptom of upper respiratory tract infection, URTE, and lung disease. A cough might be productive, where the patient cough is often described as loose and non-productive cough as dry. Sputum or phlegm might be clear or white, mucoid, yellow due to the presence of pus, purulent, or blood-stained, as in hemoptysis.
Hemoptysis. Okay. So do you understand the word flame?
Flema, ¿no?
Yeah, right. And I was wondering if you can explain to me the word hemoptysis.
Cough with blood.
Okay, that's pretty good. Thank you very much. Okay, so we have here a conversation. I don't know if you can read it, Liz and Salome.
Sure, I'm Mr. Hamilton.
Okay, so I'm gonna be the doctor. How long have you had a cough?
Oh, for years.
Do you smoke?
I used to smoke heavily, but gave up a year ago.
Do you cough up any phlegm?
Yes,
What color is it?
usually yellow.
Have you ever noticed any blood in it?
No.
Any problems with your breathing?
Yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back.
Okay, the doctor writes in the patient's case notes, CO, dyspnea, and cough. A purulent sputum for years, no hemoptysis. Okay, note, the noun phlegm is pronounced phlegm, just like that. Okay, I want you to remember this conversation because we are gonna have an exercise later. Okay, so we have an auscultation. Carla, can you read it, please?
Sure. Auscultation. Take deep breaths in and out through your mouth. Good. Now say 99. Now say. Listening to the chest with a stethoscope might reveal the presence of sounds. Apart from the normal breath sounds, there are two main kinds of added sounds. Crackles, which sound like hairs being rubbed together and suggest the presence of fluid in the lungs. Wheezes, which are more musical sounds, like whistling, and indicate narrowing of the airways. The sound of an asthma patient breathing is also called wheeze. The sound heard when the pleural surface are inflamed, as in pleurisy. It's called a pleural rub. The doctor asks Mr. Hamilton to say 99 to check vocal resonance, which might be increased as in pneumonia or decreased as in pneumothorax. After examining Mr. Hamilton, the doctor adds to his notes, OE chest, early inspiratory crackles both lung spaces, plus expiratory wheezing.
Okay, thank you. So I want you to know if you understand the word crackles and wheezes.
I think crackles is like we say in Spanish, crepitantes, but I don't know if it's the same.
Yeah, it could be. It's like ruidos. Okay, so it's more likely this word. Okay, and wheezes.
I was looking for it on the internet and I found it jadear.
Okay, but it's like a sound of whistling. So it can be traduced more like sibilancias. I don't know
Ah,
if you heard about that. Yeah, right?
okay, thanks, teacher.
Yes.
So I don't know if you have any questions of another word. Maybe a pleural rub when you have two surfaces mm, 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 like putting one against each other, against the other, and just making some noises because of the nearby, a plural rub, like frotar.
¿Cómo hacer el roce pleural?
Yeah, yeah. That's right. Okay. Okay, do you use the number 99 to check vocal resonance or you use another words?
88.
Or 33?
Okay, but you have
Yes.
another ones.
33.
we have something like that in odontology, but it's more like when we wanted to know if the patient can talk with the prosthesis, you know. If it's well pronounced, the number, okay, the patient will getting used to the prosthesis. If not, he will have for sure troubles with his prosthesis. So it's interesting.
Yeah, that
33,
is really
you,
interesting.
you told me, right? I don't know who were, maybe Salome, 33? Or,
Yes, I said.
oh,
Yeah,
okay.
because when I was in the rural year, some doctors use that number 88, and others
Okay.
use 33.
Oh, okay. That's pretty good. Thank you. So let's practice now. Okay, it says rewrite the questions using words that are better known to patients. But when with the information we had before, we're gonna find some words, some synonyms. Okay, so another way to say is your cough productive would be,
Do you
Uh,
cough up any phlegm?
yeah, it could be another option. Do you have another one?
When you cough up, do you produce any phlegm? Maybe.
Yeah, it could be in words that are better known for to patients, right? So it's good. Okay, another way to ask what color is this puddle? I don't know if there are so many ways to ask that. What
could be
color is the
what color
flame?
is the flame? Uh-huh.
Yeah, it would be an option, right? Okay, it is ever purulent. Another way to say this.
The phlegm is yellow.
Okay, another one, or we can go to 4.
Maybe it can be yellow or maybe green or just white. It depends of the bacteria. You ask them their flame is white or if they can show you it's better because they maybe don't look at it very good.
Yeah, that's right. So it could be an option. Good. Maybe for number 4, have you ever had hemoptysis?
Mm.
Does the phlegm has blood?
Uh-huh. Okay. And do you suffer from dyspnea?
Do you have problems with your breathing?
Yeah, pretty good. Okay, then we have another exercise. Are the following sentences true or false? Number 1, a patient who has a loose cough produces phlegm. That is true, or it might be false.
I think it's true. Because in general, in the most patients who has a loose coat have phlegm, could be purulent or white.
Yeah. Another one who has another position.
Teacher, I
Or
have a
you,
question. I was looking on internet and luz is suelta. So what is the meaning of luz cough? I don't remember.
It could be like a soft cough or not with phlegm,
Like
right?
dry cough.
Not dry, but maybe not purulent, but with a little bit salivation or something like that. Am I right, Salome? Are you agree with me?
Yes.
But not dry, not one and not another. Okay, it might be in the middle.
Mm. So I think it's false because phlegm is a lot of mucoid,
Okay,
mucus secretion. So if loose cough don't have phlegm, I think it's false.
okay. So what did you say before, Salome? It was false too?
Yes, but for other way, no, I still think that is true. Because for other way, when you have cold, sometimes you produce phlegm. How I said could be purulent or could be white, like a normal phlegm, but you produce it.
Okay. So do you think it's there is a difference between phlegm and sputum?
Yes.
Okay. What about you guys?
Sputum is one thing I think, and the phlegm is maybe yellow or green. Phlegm is is a problem. So
Okay.
I think are different.
Okay.
Yeah, maybe it's a salivatory
Secretion.
secretal problems. Yes,
A
nor
purulent.
a purulent type of infection. It depends. Everyone produce different type of phlegm every day. So, and when we have a cough, we produce more phlegm to protect our mucus because we can damage our throat. So I might think it could be right.
Okay. So
True.
true. Okay. And you tell me why, and I agree with you. And we will find out phlegm and sputum and it's almost the same or they are very separated of the relation. Okay, I don't know if you can find out the the connection with this between phlegm and sputum. I thought sputum was like the when you spit out saliva, right? It could be with phlegm, it could be normal, it could be purulent, but I don't know if I'm right.
Well, I think phlegm and sputum is the same thing, so I think it's true. That's right.
Okay, okay. So we are agree now. The four of us. Okay, crackles are heard when the airways are narrowed. That's true or false?
False. That was the wheezes.
Wheezes.
Yes.
Okay, what do you say, Salome and Liz?
Yeah, I'm agree too. Well, listen, wheezes and not crackles. When listen crackles when we have a lot of phlegm in our airways.
Okay, but maybe can be narrowed areas here because of the I don't know of the phlegm because of the phlegm, and that's why we can hear crackles. Can it be like that or not? Because narrowed, is It's a reduced space, right? Or am
Yeah,
I
it could
wrong?
be. I think you are right too. It could be, but I think we have the two possibilities because in the flame occupies the airways, and I think we understand narrow as like I said, estrechamiento. You will have a problem, a breathing problem. So I think we can be the both. Could be the both. Sorry.
Yeah, because here we don't have the flame that is important to hear crackles, right? Or it's not necessary.
They both could be presented, but they also can be presented alone. So it depends. If it's, but I think it's false because when the airways are narrowed by flame or by inflammation type, it
Mhm.
will be not crackles. Crackles just could be for flame. It's not a rule that they will be together. So I
Mhm.
think
Okay. Okay, that's a good point. Um, then we have a patient who has a non-productive cough produces sputum.
False.
Okay, that's false for me too. What about you, Salome and Carla?
false too.
Okay, so we agree. The only one we agree. And the first one.
Yes. It is like
This
I don't know in English debate.
debate.
Debate. It is like a debate.
Yeah, that's good. I really like to know your position, guys. It's so much interesting for me. Okay, wheezes are typical of pleurisy. Pleurisy, sorry.
For me, it's false.
False too. I think it was the heart of the pleural rub, what we
Yeah,
not
Exactly.
wheezes.
okay. Yeah, if you put in that way, yeah, it could be false. I don't know. What do you think, Salome?
The phrase to false.
Okay. And a pleural rub is a sign of asthma.
For me, it's false.
False too.
Yes, false too.
Okay. So we are agree. Okay, guys. Thank you very much. We have a great time with this topic. And I don't know tomorrow who will be the first while I send to you my my little questionnaire. I don't know where is it. Who is going to be the first and the second?
Can I be the last one, please?
Okay, so who is it?
Tell me. If I can.
Ask. Okay.
I
And
can be the first one, Carla.
okay, Carla. Better. Very good. And Liz, you
I will
will,
be the second one.
yeah. Okay, so Carla, 6 o'clock, 6:15, Liz, and 6:30, Salome. Okay, guys, thank you very much. I hope you have
Thank
a
you.
Okay.
Thank you so much.
Bye, guys. Bye, teacher.
Bye, everyone. Bye, teacher.
bye.
Thank you.
Bye, guys.
Bye.